The second one is by Dr. Alula, who will present about mental health issues and well-being.
So in order to have time for discussion, I'm going to go really fast on this, on the mental health, which is basically about resilience in times of crisis. So the round 7 survey found quite high levels of depression, anxiety, stress, and even PTSD. 17% depression, 23% anxiety, stress very high, 61%, and then of course moderate to severe being much more so, and much higher in the older cohort and in women, except for PTSD, which was higher in men. From these we selected 25 cases for the qualitative research. So looking at the stressors, COVID, looking back now, not a lasting serious issue. This young woman, when I first heard about it, I became stressed. After being screened, I was relieved. But it had very strong indirect impacts on small-scale businesses in urban areas, like this woman trader in Hawassa. No mobility of people, business activities were low. I sold the purchased items at a low price. Basically, other issues were more important. In Addis Ababa, the loss of work due to vegetable market removal. In Tigray, of course, the war meant COVID paled into insignificance. When we started talking about the war, people start talking about the war. Now, unemployment and underemployment, also particularly important in urban areas and where there's loss of work, and in the post-conflict situation in Tigray, the lack of work and limited opportunities really led to depression and loss of hope. So this young man, before the war, youth worked, had businesses. Almost all had jobs. Now everything is destroyed. The situation is very bad, leading to depression. There's also a gender dimension, more challenges for young mothers, like this young woman in Tigray. I feel I have nothing and I'm dependent on my family, baby and no job, which adds to my stress. Then there was inflation, rising prices, a major worry. This young man in Addis, this is the main source of my stress. Before I wasn't stressed because prices were reasonable. I only have stress when I feel I don't have money for basic needs. Also compounded by additional costs such as medical care, and in the post-conflict situations, the costs still remain very high. This young woman in Tigray, all costs of goods are inflating, cost of living now turned back almost to the time period of the siege. And in the war in particular, a series of different stressors, food shortages, the fear of anticipating war, experiences of witnessing violence, and of course death. My mental health problems all started when the soldiers entered our home, said this young woman in an urban area, and we haven't had to put the rest of the quote here. Separation from relatives, lack of knowledge where the fighting relatives survived. Young woman in a rural area, I was sick only because of the missing information about my brother. I haven't had any other cause that intensified my mental health problems. And then, of course, grieving over deceased relatives. Another young woman in a rural area. The grief will never get out of my mind when I see his friends who went to school together having jobs, but when I heard he died, I stopped thinking and felt relief. Now, how do people cope? Most did not have access to mental health services, mainly because these services hardly exist. And even when they do, doctors generally prescribe painkillers without psychosocial counseling. Then there is the issue of cost and referral to distant places, and that health insurance is not covered, doesn't cover mental health, making access even harder. So a young man who was at university in Dilla, he was given a referral paper to Addis Ababa, but didn't go. He said the university didn't treat him well because he didn't have health insurance and he couldn't pay for direct treatment. And then there's the fear of stigma that deters some people from seeking support. So this young man, the same young man actually, saying that he didn't want to share his problems with other people because he didn't want to be judged. Then we found that a major way, given the lack of services, was people preferred tabal, holy water. So this young woman in Tigray, I don't think the current medical services will cure him. The service is not yet improved. Maybe he could be cured about holy water, talking about her brother. Many had more faith in religious cures. In Addis Ababa, young woman, if you go there, you'll be given medication. I'd rather talk to St. Mary than a health expert. I prefer to go to church. I do not believe the medical treatment will alleviate my tension. And family support was considered crucial, as this young woman from Tigray explained how her mother really helped her. So the conclusions. Crises and resilience. These young people are transitioning to early adulthood in unusually stressful contexts of multiple polycrises that are successive, overlapping, and cumulative. Not just the economic consequences of COVID, higher education constraints, which Isaac talks about, limited employment, job losses and uncertain futures, which we'll hear about again later, high inflation eroding livelihoods, the aspirations of migration themselves creating stress, and of course, last but not least, the protracted war in Northern Ethiopia. So these crises put additional burdens and stress on young people transitioning from school to work and establishing households. But we found extraordinary resilience despite all these amongst most of the young people interviewed. There were indeed, of course, a few cases of serious mental illness. Sometimes these started in childhood, sometimes they were linked to other illnesses, or it was running in families. People with mental health issues were sometimes seen as victims of the evil eye, and there were cases that resulted from traumatic events, notably rape. How do people cope? Well, the war in Tigray leading to many stresses, including severe hunger, worry about actual or potential violence, separation from relatives, loss of mobility, worry about mobilized siblings, not knowing whether they died, grief over death, and also survivor's guilt. So the sequential and combined crises created serious challenges for all young people. Some coped better, others suffered varying degrees of mental distress and illness. Few respondents had access to mental health services, but they tended to receive just painkillers, usually without psychosocial care. So the young man in Tigray, they give the same tablet for all mental illnesses. And then the limited access was compounded by additional costs, including for travel, and also because private mental health care is mainly private, and then the worry about delays through referral and mental health not being covered by insurance, lack of confidence in service, and fear of stigma. Most, including those who received health care, felt that prayer and/or holy water treatment, while not always a cure, was often more effective. And then there were gender and family and community dimensions. Young women suffering trauma due to war violence and grief over death of husbands and brothers, and the caring responsibilities and limited mobility. Women often turned to religion and family-based coping, peer and neighborhood support, for instance, through coffee ceremonies. Whereas young men suffered mental stress during the war and post-war situation due to limited work opportunities, and some of this led to depression and the wish to migrate. There was also evidence of some young men adopting negative coping strategies, substance abuse, chat, alcohol, cigarettes, drugs, gambling, antisocial and criminal behavior. So this health worker in Tigray said, women are the most affected, but also the first to show progress after support. And then family and peer support were very important, but there were also some negative family views. So the fear of stigma led some families to hide mental illness, and seeking treatment was seen as shameful. This caregiver in Tigray, she was affected by a bad spirit, so we did not let the neighbors know. Some young families view young men as undisciplined and involved in negative coping, and they in turn feel misunderstood, hopeless, leading to the desire to migrate, about which we will hear a lot. So the recommendations, I think, let's skip these because you have them on the sheets that we'll be distributing, and I think it's more important that we get time for discussion, and we will have a session of group work to discuss the specific recommendations on the 8 issues. And so I think there were 2 slides of recommendations, but let's stop here and give a chance for response.